Good afternoon and welcome. My name is Damone Chaplin. I'm the Health Director for the New Bedford Health Department. I'm here today to welcome the Let's Get Vaccinated New Bedford initiative, the Block by Block initiative. I'd like to thank the Mayor, CIC Health, the New Bedford Health Department, and our community partners for all the support that they've given us over the several months that we've been engaged with the community here. This has been a long run for us, and I know many of you have been working with us throughout this, and so we appreciate your support. But we're not done yet. We still have work to do. Our goal is to increase our vaccination rates in New Bedford and our most vulnerable communities. We've done a lot of work over the past year, the health department, the city, and our community partners in helping and trying to support and protect the New Bedford residents. We've published legislation. We've incorporated executive orders. We've gone door to door with vaccines. We've increased our testing capacity. We've done a lot, and now we're adding another tool to the tool belt, and that is the work of CIC Health, Cataldo, with support from Blue Cross Blue Shield. And so this is no small effort. We're going ultra local with our efforts now. We're going block by block. We're taking one census block at a time. We're identifying our most vulnerable populations, and then we're setting up in communities like this right here to make it give the folks in these neighborhoods access to life-saving vaccines. And so it's really important that we encourage everyone to consider the vaccine and get educated, know the facts, and get the vax. And so I'm going to turn this over to Ms. De La Rosa for comments from Blue Cross Blue Shield.
Thank you. Good afternoon. So my name is Helga De Rosa. I'm an account executive in the municipal market at Blue Cross Blue Shield. And we're excited to be here in New Bedford today. It's a city where my father has resided for over 20 years, and a city where a lot of our associates live and work. At Blue Cross, we're committed to doing our part to help bring an end to this pandemic. And we know that vaccines are the best tool that we have. And we're proud to be part of this neighborhood focused effort that helped vaccinate 202 residents in 3 days only. We wanted to kick off this mobile vaccination program in New Bedford because while it is a city with the need for continued vaccination outreach, it is most importantly a willing and capable partner in these efforts and has been nationally recognized for its innovative pandemic response. While Massachusetts is a national leader in vaccination rates, disparities do still exist. Our goal is to help boost vaccine access in these communities with low vaccination rates. To do that, we've partnered with CIC Health, the Commonwealth of Massachusetts, and local community leaders on innovative initiatives like this mobile clinic that will help break down some of those barriers to vaccine access. In addition to improving access, Blue Cross is also working to boost vaccine confidence by producing and publishing video in working contexts like PSAs, testimonies from COVID skeptics, faithful community members, community leaders, and many other medical professionals. On behalf of Blue Cross Blue Shield, we'd like to extend a major thank you to Mayor Mitchell and his entire team on all the work that they've done and the efforts that they've done during this pandemic, and additionally to CIC Health for their around-the-clock work and all other important stakeholders here today. So thank you, and let's get vaccinated, New Bedford. Awesome.
I'm Samantha Joseph with CIC Health. We are so excited to be here today as part of the Let's Get Vaccinated New Bedford program, which was really conceived based on the idea that if you talk to somebody in your neighborhood with their own language, you're much more likely to convince them that this is a life-saving vaccine that's really the best way for them to protect themselves and their family. We're so proud to work with the city of New Bedford to plan a route through New Bedford block by block in each area where the vaccine is most needed. And we're really grateful to our partners, Blue Cross Blue Shield, for providing critical funding for this effort, and to Cataldo Ambulance Company, who's actually administering the vaccine today. CIC Health has vaccinated 1.2 million people in Massachusetts, throughout this pandemic. We're really proud to partner across the state. But what they're doing here in New Bedford is incredibly exciting and interesting and can really serve as a model, for the rest of the state. We're offering people the opportunity to get vaccinated not only at this clinic, but in their home, if that's the most appropriate setting for them. So we would encourage everybody to stop by today and to find us, somewhere in New Bedford over the next couple of weeks. Thank you very much.
Hi, my name's Kevin Turner. I'm the Chief Operating Officer for Cataldo Ambulance, and I just wanted to echo what the Samantha said and the others. And, you know, Cataldo, from a perspective, we provide the clinical services, and we're honored to do that for New Bedford, for all the areas that we're serving. And I think the partnership that we have with CIC Health and the state is instrumental in making sure that we can get that last mile done on vaccinations and offer this life-saving vaccine to people. I think this block-by-block initiative is important, and we're seeing great success with it just in the first week we've done it, because we were seeing, as most of the nation was seeing, a downtrend in people getting vaccinated. But just in the last week, we've seen a little uptick. So that says a lot. So this block-by-block initiative for us is important. And as we go from block-by-block census tracking in New Bedford, we're getting to that last mile, and that's what matters in this. Thank you.
So we'd like to thank all the speakers and partners for sorry, Carl. Sorry, Carl.
No problem. Hi, my name is Carl Alz. I'm the Executive Director of Positive Action Against Chemical Addiction, and I am also a coordinator of a nice little sub-collaboration called Vaccination Connect that includes United Way, it includes Citizens with Disability Commission, Community Economic Development Center, and other programs like PACA and others that are working together to get the neighborhoods out to get a vaccination. I lost 6 people that were close family or friends to this deadly disease, and none of them thought that they would, catch it or die from it. But this is very serious, especially today when you don't have the vaccination. So we need everybody to kind of help Vax New Bedford, and we'll be calling for more volunteers so that we can carry on this block by block. We're grateful to Damone and his team at the Health Department, CIC, for really putting a lot of this coordination and logistics together, but we need to keep this going. We need your help. Reach out to the Health Department if you'd like to be involved. We need more vaccinators, canvassers, and we need families to get involved. If you know somebody that's hesitant, we will visit your house to give you a vaccination if you'd like. So please, let's not lose anybody else.
Good afternoon. I'm Pam Cole, and I'm from the Commission for Citizens with Disabilities. That's one of the teams on Network Connect. So I work for Carl, and what we're really glad about this block to block is that there is an in-home component. You know, so many of people with disabilities just can't get out. They have functional needs that won't allow them to get out to an walk-in clinic. But this, if you text vaccine to 833-460-2202, someone will come to your houses. So that's really why the Commission for Citizens with Disabilities is really volunteering. And as Carl said, we hope to have other volunteers here, because we'll never pass this way again. If we have any opportunity to do good, this is the time that we should do it here in this neighborhood.
Thank you, Pam, and thank you, everyone else, all the partners, the community partners, for supporting us. Come out today. Get your vaccine if you haven't gotten it. If you've gotten your vaccine, encourage someone else to get vaccinated. We're going to be at Ashley Park this weekend doing vaccinations, and so we'd love to see you. Help us support and protect our communities. Get involved and get the vaccine. Thank you.
Hi, my name is Jasmine. I'm here to get my COVID vaccination. I actually live only a block over. I was coming back from Dunkin' Donuts. I walk my 3 dogs here in the park every day, and I seen the big balloon waving high. So I seen a lady that was going around asking if anybody was interested in doing this, and I said absolutely. I feel it's very necessary for everybody to get it done so nobody else gets harmed.
So convenient for you?
Very convenient. A lot of people, I feel like, don't have transportation or just feel like they're inconvenienced by going to it. So by having it here, I just think it's that much easier. I mean, it can't get any easier.
A lot of people have work, they have responsibilities.
Or kids,
Yeah.
absolutely, yeah. Or just no vehicles, and that's a huge thing. That was my main concern. I didn't have a vehicle. So this made it super easy for me.
So you, by the time that have already talked to everyone else, you already actually got your vaccine, so that was pretty quick.
Yes, it was very easy. Didn't hurt at all. I'm not a fan of needles, but I didn't even feel anything.
And which one was it? Pfizer?
I got the Pfizer. First shot. Yep. I go back to Ashley Park on the 14th for my second one.
What's your reason why? Like, why personally do you think it was so important to get it?
Like I said, I think it's necessary. The only way this kind of thing goes away is if you get vaccinated. Nothing else is going to make it go away.
Did you always want to get vaccinated?
No.
That's what I wanted to hear. Tell us about it.
Yeah, I definitely changed my mind because my doctor had told me that in the past with outbreaks like this, the only thing that makes it go away is vaccination. So that's why. And, family that I love and people I care about, I don't want to get anybody else sick.
The Delta variant, is that what you're talking about? The outbreaks on the kids?
Yeah, yep. And how they were saying in the fall it's going to get a lot worse. How it's going to spike again. So I just kind of wanted to be prepared for that.